Well, my name's Katie. I'm one of the social workers at the Alzheimer's Association. I usually do staff in-servicing. To be honest, I usually do mandatory ones, so this is quite a treat for me. Everyone willingly comes on their own accord. I do law enforcement, hospitals, nursing homes, assisted livings, home care agencies, basically whoever will have me. Funny enough, dementia isn't everybody's favorite topic. It is for me. Come on in. I have a long family history of Alzheimer's disease and vascular dementia, so that's how I got into the game. But I used to be a nursing home social worker in Houghton at their nursing home for a while, and we had a memory care unit too. So it's a personal, professional thing. Today is just Dementia 101. I'm going to give you the basics. I know for your folks, though, it does look a little different as far as the warning signs we look for. So I'm pretty informal. I want it to be helpful for you all. Some people are thinking about their job role here. Some people are thinking about family, friends, questions you have there or themselves. So you just feel free throughout to pepper me with questions. I've got a PowerPoint. It's got a couple of videos, but to be honest, I'm going to skip through those for the sake of time, and we'll just kind of make it a little bit more informal that way. Yeah, any questions before we get going? No? No? Okay. My buddy, Dr. Peterson, would have told you the numbers are increasing for dementia. And why exactly is that? We're hearing more and more and more about it.
All the food additives.
Yeah, that's part of it. We're really looking at the environmental factors, our lifestyle choices, our diet, physical activity, environmental toxins, all that sort of stuff. It can potentially increase our risk for it, for certain. They're just launching a study in 2018 to track people's activity level, their diet, their brain cognitive activity, basically how much we use our brains, and our social stimulation for 2 years to see if it can potentially increase or reduce our risk for developing dementia. The other piece too is folks are living longer. It is predominantly a disease of age. So as we're doing such a better job at curing different heart diseases, cancers, all sorts of things that honestly used to shorten our lifespan, at least here in the States, we've come a long way. So now we're living longer, and now we're seeing a higher number of folks with it. And then lastly, we're just calling it for what it is, stigma around it. Just call it like hardening of the arteries. Senile was another one, or the misconception, oh, it's just normal aging, grandma's 90, it's just bound to happen, it's just old age. I think that's one of the biggest misconceptions. It's not normal aging. If it was, everybody would get it, and we don't, thankfully. So there is very definite differences. What we really coach people on is the difference between normal aging, because there is wear, tear to your brain, just like any other old part of your body. Is if it's consistent, the changes you're seeing, meaning it's happening daily, weekly, monthly, if it's increasing, how often we're forgetting things, how often we're getting mixed up, what have you, personality changes, all that. If it's increasing and consistent, then it's something to be concerned about. If it's just, I didn't sleep well last night, or I'm pretty stressed out and I forgot that person's name, or I missed an appointment, or I got turned around because it was raining out. Here and there, unfortunately, that is just probably normal aging. So that's kind of how we draw the line between what should we be concerned about, what shouldn't we. The stigma, though, is still there, right? I mean, even my own families, they don't listen to me. It's your own family, it's a different can of worms, right? I don't want people to know I'm forgetting things. I'm ashamed of it. I don't want to tell anyone. Most of the time, though, the changes we are seeing that's not normal aging is something else that's treatable. And we'll get into that, but like hearing loss, thyroid problems, vitamin deficiencies, or medication interactions or side effects are more often than not the guilty party than an actual dementia.
Steroids.
Yeah, steroids will do it too, but
Very bad for you.
we don't even go to the doctor to find out. And if it's something reversible, a urinary tract infection, but we're so afraid of telling people that folks won't go and get screened. My buddy Joyce would have just kind of told you what she saw in herself, some symptoms. But these are the top 10 warning signs. We do a whole class just on this, kind of rolling through the different examples of changes we can see. Usually we think of short-term memory loss, right? Forgetting things, but it's so much more. Depends on the person. They might not even start with memory loss first. They might start with other cognitive changes, like drastic mood, personality changes, impaired communication, like aphasia, where they know what they want to say but they can't get it out.
My dad.
Yeah. And it has to do with a different type of dementia. So I think that's the other big question and misconception is, what's the difference between Alzheimer's disease and dementia? Isn't it just the same thing? No, it's not. There's lots of different kinds of dementia. Alzheimer's disease is just the most common type. It has to do with what part of the brain is getting damaged first. Your brain, different parts control different functioning, right? And if brain cells are starting to die in a certain part, we see certain symptoms first. So different dementias start in different places. But overall, dementia is this umbrella term just describing those symptoms, and different diseases are causing them. The way I break it down for families is I say, when you go to the hospital and you're pretty sure something is not right because nothing is staying in, everything is coming out, every which way. You don't go in and have the doctor diagnose you with a stomach ache. The doctor should diagnose what's causing the stomach ache, the nauseousness, the bathroom issues, all that. Those are the symptoms. Just like these are the symptoms, but something's causing it. So what's the disease that's causing the memory loss, the disorientation, the language impairment, all of that. These are some of those ones I was describing that can mimic dementias. But if we're treating these, then the symptoms magically go away, right, for the most part. So that's also our big push, is to help decrease the stigma so people will go and get treated for these. But here's a nice visual I like to use as far as dementias. We call ourselves the Alzheimer's Association, because like back in the day we'd come up first in the phone book. Right now it doesn't really matter so much anymore. But we help folks with any type of dementia, any sort of memory loss too. They don't even actually have to have a diagnosis. You just call us up, we'll help you best we can. Alzheimer's disease is the most common type though. That's also why we would call ourselves that. About 70% of all folks living with dementia, it's going to be Alzheimer's disease. When someone gets a diagnosis of cancer, our first question is, what kind? What stage? How far along is it? Same with dementia. That should be our first question. What kind is it? Second most common type is vascular dementia. So different things are causing brain cells to die off in different parts of the brain. Alzheimer's disease is inflammation, and the plaques and tangles you hear about are proteins building up in there, killing off brain cells. Vascular dementia is little strokes, TIAs, big strokes, cutting off blood flow and oxygen to the brain, killing the brain cells off. You can have more than one kind, not to be doom and gloom, but you can have vascular problems, right, heart conditions, and you could have a certain protein building up, so you could have mixed dementia, which just means more than one. Usually it's vascular dementia with another kind. Frontal temporal lobar degeneration, I call it FTD for short. It's a little bit of a mouthful. It used to be called Pick's disease. That one and dementia with Lewy bodies, they're kind of tied for third and fourth place, depending on who you talk to. Dementia with Lewy bodies, that was the kind the actor Robin Williams had. It looks very similar to Parkinson's disease. It's a Lewy body protein builds up in the brain, and another part that controls your motor functioning. Before you see any problems with memory loss, communication, before that, we're seeing with these folks hallucinations, delusions, sleep disorders, and then motor impairment. So the shuffling gait, the tremors, all of that. It hits people younger. So Alzheimer's disease, we're usually seeing folks 85 and up. For folks living with Down syndrome, it's usually in their 50s is when we see it. But Alzheimer's disease is typically 85 and up. Dementia with Lewy bodies and FTD, that's hitting folks in their 40s and 50s and 60s. Usually hits much younger and goes a lot quicker. You can live with Alzheimer's disease anywhere from like 2 to 20 years. Lewy body, FTD is about 2 to 10, 2 to 12 years, so it moves a lot quicker. All this is caveat to our folks living with Down syndrome. That's a little bit different. So if you have specific questions for them, you just holler at me. Vascular dementia depends on your cardiac issues, so how many strokes are happening, how often they're occurring, is how fast that one progresses. So that one's kind of halted. Okay, these are a lot of other ones. So those I showed you are just the most common ones, right? The top 4. There's lots, there's dozens of other things that are killing off brain cells that are causing these dementia symptoms. So these are some of the other more common ones. But I'm going to skip through those. We don't see those very often. Parkinson's disease. Not everyone with Parkinson's disease will develop dementia. It's about 40% of folks will, so it is an increased risk, but it's not definite. Okay. There's this little gray area, though, between like normal aging and dementias that we call MCI, mild cognitive impairment. And all that means is it's a little bit worse than just normal wear tear to your brain, but it's not bad enough that we're going to diagnose it as a dementia. It usually just means people need more help than they usually do. So instead of, doing stuff on their own, maybe at this point now they're needing help taking their medication every day, or they're needing help paying their bills where before they didn't. Other than that, they're still pretty independent. My favorite one that folks will tell me, oh, my mom, she just has a little touch of dementia, or a little touch of Alzheimer's. And I say, well, very kindly try to tell them, that's like having a little touch pregnant. You either are or you're not. There's really no in between, it's a neurological fetal progressive disorder. Unfortunately, you either do or don't. So that's still kind of the push where we're at, is helping people grasp that. Okay.
Very possessive.
I'm sorry?
Very possessive about things.
Yeah, so that paranoia, suspicion, that need to be in control of everything, and if anything's moving, it can create anxiety, agitation. Yeah, it's one of the big symptoms. The need for routine, the need to know where everything is important. We also do a lot of work with folks about changing the way we communicate with people. And I come from a medical background, so back in the day, they taught us we reality orient, which just is a fancy way of saying, like, we thought it was kinder to tell them the truth. Bring them into our reality. Tell them what's really going on. Once you're in the middle late stages of this disease, though, their reality is so different, right? They're thinking things are a certain way, or you moved their stuff, or it is gone. Their reality is different because their brain cells are dying off. So we found that we're really trying to shift that and reteach folks to enter their reality, whatever is making sense in their very sick brains. You're more likely to accomplish what you're trying to do if you just go with them, and usually it's kinder too. Often we get the question of, well, what when they're asking for their parent, they're asking for their spouse, someone that's passed away, what do you do? Depending on where they're at in the disease, you can explain the truth to them, but often you're just re-traumatizing them every time. So how do we really creatively answer their question, reassure them in the moment, without necessarily lying to them, saying, you know what, they're okay, they're not here right now. You're where you're supposed to be, and we're all here with you. They can't be here right now, but don't worry, they love you, they care about you. So how are we creatively sort of pivoting? It gets trickier when they're paranoid, suspicious about certain things. But that's the juicy stuff that I love, and we can get into that too. So like the trivia night I was telling you about, I knew nothing. But if they asked questions like, how does the brain work, and brain cells and neurons, I would have won the prize. However, I break it down for folks like I would for my own family, and I tell them, you've got like 100 billion brain cells all up in there. Each has a different job to do. One brain cell knows my daddy's name, another brain cell knows what smoke smells like, another brain cell knows what to do when I smell smoke. So each brain cell has to be healthy and strong to do its task, but they also have to communicate. That's half of it right there. If they're there and they can't communicate, they don't do you much good. If I can't see my daddy's face and send the signal to the memory of what his name is, or if I can smell smoke but I can't send the signal to the other brain cell that knows to get out of there, you're not functioning very well. So that's the tricky thing with dementia, is usually what's happening is proteins, lots of different kinds of proteins, are building up inside each brain cell and kind of disintegrating them from the inside out. And then they're kind of also building up in between brain cells and building up into plaques. So they're kind of blocking the communication. So sometimes the brain cell is still somewhat healthy and can do its job. It just can't make the connection. It's kind of like a misfire. Your engine's turning over. It's also why if you've got folks in your life who have dementia, you know how, maybe in the morning they know how to do it, and then 2 hours later they don't. 2 days later they can, and it often can feel slightly manipulative or on purpose. They know how to do it, they just don't want to. Unfortunately, with this disease, at a certain point, usually in the middle stage, their brain doesn't have the capacity to be manipulative, intentional like that. It really is, sometimes they can make the connection, sometimes they can't. When they're really tired, stressed out, had a long day, it's even harder for their sick brain to make the connection. That's kind of how I like to frame it to families, because that is often the toughest thing when you're doing direct care. And how do you know if they can or they can't? It's a day-to-day, moment-to-moment almost sometimes. Picture of a juicy, healthy, fluffy brain, as big and plump as it should be. It kind of gives you an idea of the different parts control different things. So again, those different types of dementia start in different places, but they're all progressive for the most part. So what that means is early on they look very different, right? I didn't tell you, FTD starts in the front of the brain, so it affects your judgment, reasoning, your language. So often it gets misdiagnosed as a mental health disorder, bipolar, extreme anxiety, depression, substance abuse. It gets misdiagnosed for that when really it's a deterioration of that part of your brain. But all of them spread. So they're all, for the most part, progressive and fatal. So eventually they all wind up in the back of the brain, the brainstem, where your brain cells have the jobs of telling your heart to beat, your lungs to breathe. More often than not, though, we see other conditions crop up, like pneumonia, infections, that sort of thing. So, left side is a plump, healthy brain. Right side is one very late stage Alzheimer's disease. So while those brain cells are kind of dying off, your brain is pretty neat. It is self-cleansing, and it is going to rid itself of dead tissue. So it's literally shrinking. That's why our folks, kind of one of the ways we test for what stage they're in and kind of track the progression is every year they'll get an MRI, CAT scan usually, and they're looking to see from the baseline what areas are shrinking more than other areas, how much has it shrunk. That's how we can really tell. It's also why we really worry about falls. Falls prevention is a big thing, I'm sure also in the group homes and the workplace. If folks balance, motor functioning isn't great to start with. We're already hypersensitive about that, but for these folks, not to be graphic, but for you and I, supposedly, we all have very healthy brains right now. Your brain is just the right size for your skull, or it should be. So if you or I fell, it's just a little bit of wiggle room in there. Someone that's brain is shrunk a lot and its skull is the same size, when they fall, they could have multiple concussions, damage to the brain, bleeding, trauma, that sort of thing. So that's also why we're hypersensitive for them regarding falls. This is usually everyone's biggest question, especially someone like me that has a long family history. What are our risk factors? How do we kind of reduce that risk or know where we're at? Age is the biggest one for Alzheimer's disease. Once folks hit 85, it's a 1 in 3 chance of developing Alzheimer's disease. Folks living with Down syndrome, I keep referring to that because I'm assuming you all have folks living with Down syndrome at the Resource Center services. Okay. For them, their aging is accelerated to the extent their 40s, and by the time they hit age like 40 to 49, it's a 10 to 20% risk. Once they hit 50 to 59, you're looking at around a 30 to 50% risk. If they're living into their 60s, it can be up to 70% risk of developing Alzheimer's disease, which is about 6 times the the average age parallel folks without Down syndrome at age 60, about 6 times higher risk. So a lot of research is trying to focus specifically on folks with Down syndrome to see why that is. Part of it is the accelerated aging, we know that. The other piece, though, is the protein that I'm talking about that builds up in the brain happens to land on an extra chromosome. So they've got 3 copies of it. So the likelihood that it's overproducing that protein is much higher. women, this slide's a little old, to be honest. Used to say that as women we're at a higher risk. Part of that has to do is we just live longer. So we're more likely to hit age 85, so we're at a higher risk. Heart health, we're learning more and more about, is directly linked to your brain health. So if we're at a higher risk for heart disease, it also can potentially increase our risk for a type of dementia. And not trying to like use stereotypes and just referencing it because it is actually kind of true. We're more likely to go to the doctor and get the diagnosis. So we're probably inflating our numbers a little bit. It's probably not as that much of a difference as we think. Family history, that has to do with the type of dementia, but for Alzheimer's disease, if you've got, well, everyone's got, let's say, 10% risk, depending on what age we are. If you've got a parent or a sibling, it's going to bump you up to a 20% risk if they had Alzheimer's disease. Grandparent, uncle, cousin doesn't really play into your risk factor, but a parent or a sibling will increase it. Doesn't mean it's definite. So you could have a parent, both parents, you could have siblings with it and still not get it. You could have no family history and still get it, but it will increase our risk a little bit.
So the way to be diagnosed with dementia, is it really only through an MRI, or can they diagnose it with just the symptoms?
It's both. That is my next slide. Thank you.
You're welcome.
There is no one, there's no one dementia doctor. So any doctor can technically diagnose it. A lot of folks use their, even a nurse practitioner, to be honest, or a PA could. Usually folks are using a neurologist to do it, and this is the assessment process. So they're looking at family history and all that. They are really going off of symptomology. So whatever symptoms they're presenting with, they're trying to rule out everything else that could be causing it. So that's all the testing. They're screening out mental health, they're screening out blood work, infections, sensory loss, all sorts of things to see what else could be causing it. And if nothing else is causing it and it continues to progress, they can do a scan of the brain to do a baseline, and then they're going to check 6 months every year to see shrinkage to monitor it. So it's about a 90% clinical accurate diagnosis at this point. They have a new scan out called a PET scan, PET scan, and they can inject your brain with a dye and it will light up on those proteins. The tricky thing is we all have the proteins in our brain for Alzheimer's disease. It's just certain people have more than others. For folks living with Down syndrome, they have a higher number of those proteins just baseline, and may or may not get Alzheimer's disease. So it's not definitive yet. Also, your insurance won't cover it. It's thousands of dollars.
Right.
So if you're linked with a clinical trial, they'll do the PET scan for you for free, depending on your trial. So that's kind of one of the perks, among others, of being in a trial too. They just created a new trial PET scan, a different dye for a different protein. Our football players, hockey players, impact sports folks. The news has really been talking about CTE, right, as far as trauma to the brain and their, what was that one fellow, Hernandez, that passed away this year? So it's a different dye they put in the brain. It lights up a different protein that's really correlated with CTE. And they're recruiting people to be a part of that too. So that is kind of where it's moving. Until folks are willing to fund it, it's kind of stalled a little bit. But yeah, good question. The other piece though is they're going off of friends and family. Usually folks living with dementia are not the best self-reporters due to memory loss, due to a lack of self-awareness from the disease. They're not always the most accurate, so they really rely on other people describing what's going on too. Okay, so there is a range of emotions that come with it. For any of us, I guess, who have had a serious medical diagnosis, it's not too different, right? Sometimes you're relieved to know what's finally causing it. Sometimes you're just mad, angry, fear, grief, a whole range. It's kind of like the grieving process too. One day you'll be accepting it, next day you'll be pissed off, next day you'll be sad. When I'm working with families, they often, and individuals, they often feel this powerlessness. Because right now we don't have a way to cure it. We don't have a way to slow it down either. So we'll talk about medications in just a minute. So that lack of power as far as control in America, we really like to be in control of ourselves, our family. We don't really like that feeling too much culturally. So we tend to fixate on things we can control, which usually, I come from a nursing home background, we're fixated on how much are they eating, how much are they drinking, how much are they walking around, and we kind of forget to look at the big picture quality of life when we're dealing with terminal illnesses. We lump it into 3 stages. You'll hear 5 stages, 7 stages, 9 stages. We just lump it into 3. Everybody progresses differently at a different rate. Normally the middle stage does last the longest. Early stage you might not even notice. People are really good at coping and sort of hiding, I guess, that some memory loss or forgetfulness. By the middle stage it's tough. The communication is pretty much impaired beyond hiding. Needing more and more prompting reminders for daily tasks. Changing clothes, taking medication, to the point of sitting down eating their meals, all of that. It's where the safety concerns really come into play as far as wandering, getting lost, leaving stoves on, that sort of thing. Late stage is that stereotypical, round-the-clock, total assistance with all of the ADLs, the bathing, the toileting, the dressing, the feeding, what have you. My friend Dr. Parker would have told you this about how this is not everybody's favorite topic. My poor family, we talk about it every year at Thanksgiving. People stop coming, I'm not offended. But you know, it's not just this disease. Talking about healthcare proxy, power of attorney, living will is important for anybody. We never expect tragedy to strike, whether it's a car accident, cancer, a dementia, what have you. So talking about things ahead of time when you're not in a crisis. I've been the family at ECMC at 2 in the morning trying to decide what to do as far as life-sustaining treatment, and it's terrible. I've also been the family that's had the conversation ahead of time for somebody else, and it's slightly less awful. It's still not great, but it makes it a lot less traumatic. You feel like you make better decisions when you talk things through ahead of time. And for our folks living with dementia, early on, they can still be a part of that conversation and tell us what they want. And that client-centered care, that person-centered care, that's when it's important to really rope them in to that conversation. Which is why fighting the stigma is so important, because if we let it go for too long before we say anything, then we've missed that window of time for them to have capacity to fill out a healthcare proxy, whatever, but also just to talk about it. So we've got 4 drugs. There's actually a 5th one that just came out, but it's that combination of 2. So it's the same medications. Aricept, Exelon, Razidine, and Menda are usually the names that you're seeing. What these are doing, they're not disease-modifying drugs, so they're helping to lessen the symptoms. So I explain it to my families of, when you got a really bad cold, you're just coughing all through the night and you just want to sleep. So you chug your cough syrup, it is not really touching the virus or whatever is causing your cold. It is just lessening the intensity of my symptoms. So instead of me coughing 50 times through the night, maybe I'm only going to cough, 5 times. It's not curing my cold, it's not slowing it down, it's not preventing it, treating it, whatever. It's just touching the symptoms. And that's what these drugs do. The first 3 are flooding your brain with a good chemical that we all have in our brains that are just trying to help whatever brain cells are still alive make a connection a couple more times than they would without. They're not stopping the proteins from building up or the strokes from happening, so that deterioration of the brain cells dying off, is still going to continue. It just makes the symptoms less severe for a time. The 4th one does the same thing, except it's taking out a chemical that's overproducing to, again, help the brain cells talk better while they can. So it might translate into somebody, instead of me asking you 20 times, no, when's my appointment? No, when are we leaving for the doctor? When's my appointment? What time are we going to? Over and over and over again. Maybe my brain cells can make the connection a couple more times. I'm only going to ask you 2 or 3 instead of 20 times in the hour. That's sort of how we can see if it's working. How do you know, though? How do you know they're not going to ask 2 times as good instead of 20? We don't. So often doctors prescribe it as long as the side effects aren't too severe. The biggest side effects we see typically, I stole all my info for him, so don't worry. Actually, this guy, a little juicy fact, my friend Dr. Peterson. You know Glenn Campbell, the musician, this is his doctor. It was his doctor, yeah. This is my mini soapbox, so please forgive me. Because of my long family history, it's a personal, professional thing. But I tell people we could have all the money in the world for research, which we don't, but let's pretend we did. If we didn't have people to be in the research, it wouldn't do us any good. We are the third biggest funder for research in the world, actually. We're the biggest nonprofit. The government of China and the United States government beat us out, which is totally fine. We don't care. We just want people to put money towards research. So one of the flyers back there talks about it. We've got a nationwide database. They're looking for healthy folks, people with a family history, people without a family history, people living with the disease. Sometimes all it is a survey, like what's your diet, where do you live, what's your environmental factors. Sometimes it's a new drug, like in Buffalo, Rochester, they're trying out some pretty new cool drugs as far as could this delay the onset by like 10 years? Could it prevent it from even starting? So we're making progress, not as quick as I think any of us would like, but we're making slow, steady progress towards finding a way to prevent it, to delay it, to lessen the speed of it. But we're really focusing a lot right now on the lifestyle factors that could reduce our risk, which would be the diet they're looking at is the DASH diet, Mediterranean diet, which is basically heart healthy. It's kind of what the food pyramid says to eat anyways. Not a lot of fatty food, processed food, sugars, really none of that. Eating a lot of fish, leafy greens, healthy oil, nuts, a little chicken, not much red meat. Basically what they tell us to eat anyways, it's good for your heart. Each pump of your heart, about 20 to 25% of that oxygen-rich blood rushes up to your brain. So if your heart is not healthy, your brain will not be healthy either. Physical exercise is the biggest area of research, looking at reducing your risk. They've looked at lots of different things. So for me, like I was telling you, I'm not so much a runner. They looked at folks that run, 60 minutes, 5 days a week. And they looked at some of us who will walk for 30 minutes, 5-6 days a week. Equally beneficial. Oh, wow. There wasn't a difference there as far as brain health. Basically, they just said whatever you're willing to do to be active, bike riding, Zumba, yoga, as long as you're going to do it, pick something you like because all of it's beneficial. So physical activity, the heart healthy diet, the fourth area they're looking at is cognitive stimulation. So that's a little bit nuanced. So it's not just, I'm a crossword lady, I'm going to keep doing crosswords all my life. It's good, it's maintenance, but they're really saying you need to do challenging brain activity, forcing your brain to think on its feet, adjust, adapt, strategize.
Board games.
Board games, that's my best example. My husband loves that Settlers of Catan. Does anyone play that? Oh, it's awful. He loves it. And cards. Pinochle, bridge, what's that other one? Spades, I think, where it's strategy. You're adjusting hearts based on what people are playing. Learning new skills, hobbies, languages, instruments. I'm not that ambitious, so I count learning a new recipe. It also happens to be a heart-healthy recipe. You kill two birds with one stone. So something that's challenging my brain. If I am an avid reader, and let's say I read all about history, I need to pick a different area of history to start learning about. So it can be that simple too. You're just always trying to challenge your brain. The fourth area is social stimulation, social connection. This one, they're not really sure why it's helpful other than the fact that when we're well supported socially, whether it's one friend, 10 friends, depending on the person, you're much more likely to make better decisions in the other three areas: physical activity, diet, and challenging your brain. So if you can combine more than one at a time, they actually found that it's even more beneficial. One, it saves you time and money, but two, the benefit for your brain is more as well. So end of my soapbox. I will wrap up and tell you as far as stuff we've got going on. We cover all 8 counties of Western New York out of our Williamsville office, but we are all across the country. So we've got an office in Erie, PA, office in Rochester that covers the Finger Lake region. I think I'm a little biased because the other hat I wear is I run our 24-hour helpline. So usually it's me you get on the phone, but it is good 24/7. So often it's professionals calling on behalf of their clients, trying to brainstorm, problem solve scenarios, tough situations. Sometimes it's family members calling, looking for resources, information. That's free 24/7. We've got lots of classes. If you grabbed a magazine looking thing in the back, that lists all the classes. Support groups all over. We're starting a new support group I'm really excited about. It's in Buffalo with the Heritage Centers. Some of our folks living in group homes who have roommates who are developing Alzheimer's disease are really struggling. So we're trying to do one just for our folks living in the Heritage group homes that have roommates with dementia to support them. But a lot of
anything local in this area?
Yeah, we've got 2 in Jamestown, one at the Fluvanna Church and one at JAMA, Jamestown Area Medical Associates, right?
Whatever.
Yeah, so we've got 2 there, we got one in Fredonia. We partner with the Chautauqua Office for the Aging. So the gal there, she also has 2 or 3 up and running. I think one's in Mayville, one is also in Jamestown, so she's got the dates and times for those 2. Chautauqua Opportunities, that nonprofit, I think they're in Dunkirk, right? They also partner with us too, and they started a couple support groups too. So between the 3 of us, we got oodles going on in Chautauqua. The Office for the Aging also starting to do some, social activities, fun events. We call them caregiver wellness events, but it's for families to have a break to go and do something special. Go see a movie together, do watercolor painting together, different things every month, just for folks and their loved one with dementia, a safe environment where you can forget stuff and it's totally okay. You can be repetitive and that's fine too. So that's out of the Office for the Aging. But yeah, that's all I have for you guys. What questions do you have? Thoughts? Feedback?
I have,
Yeah.
if you said this in the beginning, I apologize. Is memory always affected? At least, I have a 90-year-old mother,
Yeah.
sharp as a tack,
Yeah.
has a better memory than me, but she's become even meaner than she was when she was 60 or 30, or
Yeah.
probably childhood for all I know. But,
Yeah.
So, she stamps really quickly,
Yeah.
but she's just as sharp as can be.
It's more the personality, the mood. Yeah, so memory is always a part of the disease at some point because it progresses. So if it is a type of dementia, years down the road, the memory might be impacted. That personality mood change could be a lot of things causing it.
I mean, she's never really been a ray of sunshine. But she's just, she just snaps at my dad quicker than she always has. But I mean, she's just, she's just quicker to do that stuff.
Yeah, that quick to anger, quick to snap. And I don't want to be ageist and stereotype and say that older folks tend to get a little bit more curmudgeony, because that's not fair, not everybody does. But we do see a little bit more of it. If you start to see anything else going on other than just that, I would probably say something to her doctor. Sometimes what we find is folks are acting out in that way when it might be another medical reason, like pain, untreated sensory loss that's coming
She's
out.
too private to share that information.
Yeah, I'm sorry. Then we prescribe lots of breaks, lots of time apart. I tell families all the time, you're only blessed with so much patience. Just because somebody starts presenting with whatever symptom doesn't mean you're magically blessed with more patience. So you can only handle it so long you give yourself grace. Yeah.
Does she snap at others as well, or is it just your dad? Not that I'm an expert, but
She's always snapped at my dad, but she's snippy with everybody. I guess that's the best way to say it. She's very short.
Mhm.
So there's no one person trigger.
Well, I mean,
He is the
they're
big-
together all the time, so
Yeah.
that would drive me crazy. But, but I mean, like even with the grandkids, I mean, who doesn't want their grandkids?
Yeah.
But she's even kind of snippy with them,
Yeah.
and that was never her, not her thing. And short, you know, Mom, what do you want for lunch? I told you I wanted chicken noodle soup. And she probably did.
There's an edge.
Yeah.
Yeah.
There's an edge, that's the
Yeah.
better word, yeah.
Based on family norms, as far as family communication styles, sometimes it's enough to call them out on it, make them aware of it. Sometimes that causes more trouble, and I totally get that, because that's my family. That's why we don't talk about things. But sometimes it's enough to call them out on it, and they're not even aware. But each family is different.
I think she's aware, she doesn't care.
And that's another problem. Yeah. Other questions you guys have? Thank you.
I had I volunteered with hospice, and I sat with a woman who had Alzheimer's who also went blind,
Mm-hmm.
which I never, and I was watching to see if that was any of your.
Yeah, so when we go back, I'm going to be real crazy and skip all the way back here. So that is one of the warning signs I love to talk about, and I skipped today, so thank you for saying that. Hang on, here we go. Number 5, trouble with visual images, spatial relationships. So what's happening with any type of dementia, eventually we're going to see this, is your eyes could be perfectly fine, but your brain is what's decoding the messages your eyes are sending up to it. So how it starts is they lose their peripheral vision, so eventually they can only see this. As it continues to progress, it's going to binocular vision. So usually their depth perception is way off. So someone has a cup here, and they're grabbing here, they're grabbing here. Their depth perception is off, or if it's not in this line of sight, they don't see the cup, they don't see you, what have you. Eventually it continues to progress. There's a monocular vision, and that's when the depth perception is super bad. Color contrast is bad too.
What is it with the red?
Yeah, they're starting to see fewer and fewer colors, which is tough as well. Early on, that's why driving is real scary.
Yeah.
But it even goes to the point where people are, if you've got a white plate, and I've got like mashed potatoes on there, their eyes can't process. It just looks like one blank white thing.
Mm-hmm.
So folks start to use red plates or blue plates. We don't eat a lot of red or blue foods on a plate, so that helps with the contrast. If you've got a white tablecloth too, that makes it even tougher. So we play on that to help us or hurt us. For folks that are at risk for wandering a lot, we will paint the door the same color as the wall, the door handle, the door trim, the wall, all the same color, because then our depth perception isn't great. We can't find the door handle as easily or even see the door. So sometimes you can use it to your advantage if you need to.
How about our senior adult, they have toilet seats.
Yeah, because that will contrast against almost everything. We don't usually decorate or paint with red, so it makes it a lot easier to find it and aim and be successful. Yeah. Good question, good point. Same for your other senses too, though. Auditory senses, you know when people first get their hearing aids and they say, ugh, it's just too much background noise that it's just, ugh, I can't filter it all out. That is eventually what happens for these folks too. Your ears might be perfectly fine, but your brain is in charge of decoding all the noises. The projector humming, a phone ringing, footsteps, voices, radio, whatever, and your brain, as it gets sicker and sicker, can't process all that, and sometimes that noise is what stems the agitation, the anxiousness, some of those behaviors. We do some of those professional in-services I was telling you about talks a lot about triggers as far as stimuli going on. Our folks living on the autism spectrum, that hypersensitivity, hypo, it happens for folks living with dementia too. Their brain can't process tactile sense either. So sometimes someone with dementia is going to grab you so hard like they're going to break your arm. And they just think, they're lightly touching you. Their brain can't register that. However, other areas get hypersensitive, which unfortunately is the area we give personal care. The mouth gets really sensitive, the hands and the genital area. So as people are giving personal care, the lightest little touch can almost feel like a slap or a scrape. So that is also sometimes where they're resistive and combative with care, is because of the sensitivity going on too. on that note, and I know some of you are on your lunch break, so I don't want to keep you, but do you have other questions, thoughts, stories?
Thank you.
You're
Very,
welcome.
very
Thanks you guys
good.
for coming. I know it's voluntary, so I appreciate it.